Hello everyone, I hope you're well. Today I'm talking about irrational and random use of antibiotics and risks of superbugs. We all are very familiar with antibiotics. Bacteria cause different diseases to our body, and sometimes we get some infection in our body, and doctor give us antibiotics, and these antibiotics kill these bacteria and cure our infection in our body. But these bacteria don't want to die, they also try to survive. And therefore, these bacteria adopt a different strategy to escape the effect of antibiotics. And they try to survive and avoid the effect of antibiotics. And sometimes, if we do the irrational and random use of antibiotics, then it can create superbugs. And that's why World Health Organization in advising the government and people of every country for the rational use of antibiotics. If we take the rational use of antibiotics, then it can preserve the efficacy of antibiotics for future generation. Therefore, it is very vital to preserve or protect the efficacy of antibiotics. If we cannot protect the efficacy of antibiotics, these antibiotics will not protect us even from common injury. Therefore, you must take antibiotics when only your doctor prescribe it for you. When your doctor advise you to take the antibiotics, without doctor consultation or advice, you must not take antibiotics by yourself. And when you take antibiotics, you must complete the course of antibiotics based on your doctor advice. Some people, as for example, some people don't complete the course of antibiotics. Doctor advise them to take the antibiotics for 5 days, and they take the antibiotics for 3 days, and they feel physically healthy or good, and they stop taking the antibiotics for other 2 days. But it is very dangerous if you don't take the course of if you don't complete the course of antibiotics. Bacteria will develop mechanism to become irresponsive to these antibiotics. That means these antibiotics will not work for you in future. Therefore, you must complete the course of your antibiotics. Another thing, you must not share your antibiotics with your family members or friends, because doctor prescribe it only for you based on your specific signs and symptoms. And signs and symptoms of your family members or friends may be different. Even they don't need antibiotics. Therefore, you must not share your antibiotics with your family members or friends. And some certain viral infection really don't need or require antibiotics. Therefore, you must not share your antibiotics with your family member or friends, and you must complete the course of antibiotics based on your doctor advice. This is the end of my video. Thank you for listening. Bye for today.